What are Agent Orange presumptive conditions for Vietnam veterans? Imagine serving your country and then facing health issues years later that are hard to explain. Many Vietnam veterans experience this because of Agent Orange exposure. During the Vietnam War, the military used a chemical herbicide called Agent Orange to clear dense jungle foliage. It contained a dangerous chemical called dioxin, which is linked to serious health problems. Veterans didn't always know they were exposed to this toxic chemical. That's why the U.S. Department of Veterans Affairs created a list of diseases they automatically link to Agent Orange. This helps veterans get benefits without proving the chemical caused their illness. The list includes over 50 health conditions. Some of the most common are different types of cancer like bladder cancer, Hodgkin's disease, and non-Hodgkin's lymphoma. Other cancers such as prostate and lung cancer are also included. Besides cancers, there are other health issues like chloracne, a severe skin condition, and type 2 diabetes mellitus, which affects blood sugar levels. High blood pressure, underactive thyroid, and heart problems like ischemic heart disease are also on the list. Parkinson's disease and Parkinsonism, which causes movement problems, are recognized as related to Agent Orange. Nerve damage called early-onset peripheral neuropathy is also included. To qualify for these benefits, veterans must have served in specific locations and timeframes. Service in Vietnam from January 9, 1962 to May 7, 1975 automatically qualifies. Service near the Korean Demilitarized Zone from September 1, 1967 to August 31, 1971 also counts. Veterans aboard ships operating in Vietnam's inland waterways or coastal areas are eligible too. Recent expansions include service in parts of Thailand, Guam, and Johnston Atoll during certain periods. Because of these rules, the VA presumes exposure if service criteria are met. Veterans don't need to prove that their health condition came from Agent Orange, which makes applying for benefits much easier. Sometimes, health issues develop as secondary conditions. For example, complications from diabetes or heart disease linked to Agent Orange can also be considered for benefits. This recognition reflects the long-lasting impact of chemical herbicides used during the war. It also shows how advocacy and research helped improve support for veterans over time. Veterans diagnosed with any of these conditions and meeting service criteria can apply for disability compensation and health care. The presumption helps ensure they get the help they deserve without complicated proof. In short, Agent Orange presumptive conditions are a set of diseases linked to herbicide exposure during the Vietnam War. They help veterans access benefits more easily and acknowledge the lasting health effects of chemical exposure.